Hi Renee, my name is Shelby. I'm going to be your student nurse, and I'm just going to do some family assessments with you. So I'm just going to ask you some questions, and you can just answer as you see fit. So we're going to start with the structural portion of the assessment. In terms of internal structures in your family, I understand that your immediate family consists of you, the mom, your husband Will, the dad, your 15-year-old daughter Clarice, and your two twin boys who are 9 years old. Can you think of anyone who is like family but not necessarily biologically related to you?
Honestly, not really. We have a few close family friends, but they're not really family, I would
Okay,
consider.
okay. Within your family of five, have you noticed any distinct groups?
I would say the twin boys are definitely closer, I think just because of their age, but not much else other than that.
Okay. Do you and your husband have any distinct expectations of your children based on their ages or their rank from younger and older?
I think since Clarice is older, she's a pretty good role model for the younger boys. But since they're so young, we just want them to focus on school. I don't really have much expectations. They're good kids.
Okay, that's good. I understand that you and your husband disagree about treatment and whether or not you should tell Clarice about her diagnosis. Does your family have any strong boundaries or rules about topics that aren't to be discussed outside of the family?
We're a pretty open family, but I guess yeah, anything personal, we keep it pretty private. Um, I think that's why deciding whether or not to tell Clarice is such a big deal because we don't really want other people to know. We don't want anyone to look at her differently.
Okay, I can understand that. Okay, so moving to the external structures of your family. Um, I understand that you, Renee, your mom died at 65 from, oh, sorry. I understand that you, Renee, um, excuse me, what I meant to say is I understand, Will, that you have no siblings and that your mom died at age 65 from breast cancer and that you also visit your dad in a nursing home daily. Would you consider yourself close with your dad?
Yeah, I was always pretty close with my dad, but now that he's in the nursing home, he's not really the same person as he used to
Okay.
be, so it's kind of hard to talk to him now.
Okay, I understand that. And do you have any other siblings?
No.
Okay. And what about you, Renee? I understand that your brother died at age 17 from brain cancer, but you haven't spoke about your relationship with your parents. Do you guys talk? Do you have a close relationship?
Yeah, we talk. We're not overly close, but I see them fairly regularly.
Okay.
They help with the kids.
Okay, that's good to know. Um, okay, so do you have any other family members that you speak with regularly?
Not really, no.
Okay, so you talk to your mom and dad, Renee. You talk to your mom and dad regularly, but you're not overly close. And Will, you said that you're always been close with your dad, but you feel like he's a bit of a different person now that he's in the nursing home. Is that correct?
Yeah.
Okay. Um, when your extended family goes through times of illness, Renee, like with you with your brother, Will with your mother, and now your father, have you found that your extended family becomes close? Are they supportive? Are they helpful for you?
Um, I think when Will's mom passed, his extended family was very good about it. But when my brother passed, I think it kind of tore our family apart. They were supportive, but everyone just kind of did their own thing. Didn't
Okay,
talk about it much.
okay. Thank you for letting me know that. What about now, in the time of your daughter's illness? Do you find that your parents are supportive with this?
I haven't really told them much about what's going on.
Okay, thank you. Okay, and in terms of larger systems within your family, what agency professionals are you involved with in your family, if any?
Not really. Like just with the hospital and Sarah's school knows that she's sick, but we haven't done much. And I think we were thinking about doing something with our family. I'm not really sure what, if you have any suggestions.
Okay, yeah. So if you think that there's anything that I can be helpful with to support you, I'm definitely here to do so. Have you considered like family therapy or anything like that?
Yeah, we definitely want to look into that, or like if there's any sort of support group for Clarice if we get there or something.
Okay, I can
For the
definitely help
boys.
you with that. I can also talk to the social worker on the team if you're interested and kind of help you in that area to navigate therapy and that kind of stuff.
Yeah, we'd be interested. Thank
Okay,
you.
I can definitely help you with that. You're welcome. Okay, so that I can understand the context of your family a bit better in terms of how you guys do things. Has your ethnic background influenced your beliefs about healthcare at all, would you say?
No, I don't think so.
Okay. Um, okay. And in terms of your social class, I understand that you, Renee, are a pharmacist and that you work full time at 3 different pharmacies. And I understand that you, Will, are an entrepreneur. Is that correct?
Yeah.
Okay. How do you think your work schedule affects your family life?
Um, I think it affects it a lot. It's just hard to be around, but we need the money, especially if Sarah's sick.
Okay. My next question was going to be, are you guys facing any economic challenges right now? And I heard you speak about Clarice's illness. Do you have any other challenges at the moment?
Not overly. I think we just want to be prepared. Because I have a feeling we're going to be taking some time off work and that.
Okay. If you guys want to talk to somebody about that again, I can help you talk to the right person. Okay, moving along to religion and spirituality. Do you and your family members practice anything that's spiritual specifically?
No, we don't practice any religion.
Okay. Okay, and then in terms of environmental context, do you enjoy the neighborhood that you live in?
Yeah, everyone's pretty friendly. There's a lot of kids in the neighborhood.
Okay, that's good. What about community services? Does your family use any community services?
No. Um, I guess we've just never really looked into it.
Okay. Your community might actually have some good resources in terms of services for therapy or group therapy, like you said, you might be interested in for Clarice. And so I'll definitely look into that for you and help you if you'd like.
Okay.
Okay, so now we're going to move on to the functional assessment portion. In terms of instrumental functioning, who would you say is usually responsible for housekeeping and childcare within your family?
I would say it's pretty even for housekeeping, but I think lately Will spends more time with the kids because I've been working so much.
Okay. Do any other family members help with tasks within the home, like your children or anybody?
Just like their own space, keeping it clean, and like Clarice will sometimes help me with dishes and stuff, but we don't have any set chores or anything.
Okay. So I understand that you guys said that things are pretty split pretty evenly. Is that correct?
Yeah.
Okay. Do you know if one of you two, between the parents, are gonna take primary responsibility for Mary's care in terms of hospital, or do you think that will be pretty even as well?
Um, I hope it's pretty even. I'm just waiting to hear if I can take a leave from one of my jobs because I don't want Will to have to do it all by himself.
Okay. In terms of expressive functioning, we're gonna move to emotional communication. Are you guys able to tell when each family member is happy or sad or feeling stressed?
Yeah, I think so.
Okay. In terms of verbal communication, is there anyone in your family that is best at, best at communicating clearly?
Clarice is pretty good at telling us how she feels. It's kind of how we ended up taking her to the hospital. Um, but I think the boys, just their age, like, they're kind of hard to understand.
Okay. Do you think that there is a need for more effective communication? And do you think that you can think of a way for family to for your members of your family to communicate more effectively?
I think just between Will and I, we're having a hard time deciding, like coming to a compromise. So we have to figure out what to tell the boys. Yeah, I really don't know what to do.
Okay, we'll definitely try and help work through that if you'd like. Some families find it helpful to talk with one of the nurses about the life at home and about learning about your daughter's illness. Do you think that your family would find that helpful?
Yeah, I think we need to know more what our options are, but we have to hear from the doctor.
Okay. Okay, so in terms of problem solving, you guys have expressed that you're having a difficult time problem solving about whether or not to tell Clarice about her illness and just problems about what you should do in so far as care. Do you think that between the members of your family, there's a person who notices problems first?
It really depends the problem. Like, Clarice noticed she wasn't feeling the same, but I think it's hard for us to deal with it now.
Okay. Did you or Will notice, did one person between you and Will notice that you're having a problem with problem solving now, or was it kind of mutual?
I think definitely mutual because it's just kind of like a disagreement. We're both on very different pages right now.
Okay. And then, in terms of your beliefs, do you guys have any specific beliefs about what is causing your daughter's illness?
Well, we're not a very religious family, so I don't think it has anything to do with something spiritual, but both of our families have a history of cancer, so I have a feeling it must be something to do with that.
Okay. And then, just to wrap up, do either of you have any questions for me? Or anything that you think I should be aware of that I haven't asked you about already?
We're both just so stressed, and I don't know, what do you think we should do?
Okay, well, in terms of offering recommendations that I can think of, I think that it would be helpful for you to be connected with a social worker and either go through therapy between you and your husband to help decide what decision needs to be made, because I do think that a decision needs to be made about whether or not you're going to tell Clarice. I also think that if you decide to tell Clarice, it could be very beneficial for her to also see therapy, and maybe, like you said, just like family therapy in general as the context of your family begins to change in terms of the illness of your daughter. I do want to commend you because it seems like although you guys are having a difficulty with problem solving, you're being very open about that fact and that you seem very receptive to help, and I think that's a really positive thing. It also seems like your family's pretty close. Like you said, you don't talk to your parents that much, or you don't feel super close with your parents, but you do talk to them a lot, and it seems like within the family, except for the specific thing, like I said, you're not sure what to do, it seems like you really listen to your daughter when she's talking about things, and when, like you said, she was the one that brought up the fact that she wasn't feeling well, and I want to commend you guys on that.
Thank you. I just hope we can figure this all out.
We'll figure it out together.